Hi folks, welcome to my YouTube channel. So in this video, we will discuss about the smooth muscle tumors of uncertain malignant potential or the stump. So in our previous video, we discussed mainly about the benign category of the smooth muscle tumor, which was the leiomyoma. And we have a malignant category, which we will discuss in our future videos about the leiomyosarcoma. So in between those categories, we have an intermediate category which is known as the stump or is a smooth muscle tumors of uncertain malignant potential. So by definition, this tumor has the morphological features which exceeding the diagnostic criteria of a benign leiomyoma, but it has insufficient morphological features to label it as a leiomyosarcoma. But what is its importance and how we have to put the patient under surveillance, we will discuss those features as well. So in terms of epidemiology, it is very rare. It commonly occurs in the reproductive age or in the post-menopausal woman, and the mean age of its occurrence is around the 43 years of the age. While in terms of a site, it mainly arises from the myometrium and rarely it can arises from the broad ligament, ovary, cervix or the vagina. And in terms of a pathophysiology, it also has a genomic heterogeneity like leiomyosarcoma. So it ranges from few chromosomal alteration to high chromosomal instability, and mainly in 10% of the cases, it has been seen that the MED12 gene has been implicated in the pathophysiology of the stump. While in terms of a clinical features, the symptoms are totally similar with the uterine leiomyoma. So clinically or radiologically, it is really impossible to diagnose or to differentiate between the uterine leiomyoma and the stump. And even on the gross examination, we have to pay clear attention because the benign type of the leiomyoma is very rounded, well circumscribed, white veins, and very firm. But during grossing, if we are observing that the tumor has the infiltrative borders, tumor is trying to replace the endometrial cavity, or the tumor has a necrosis, then at this point it is mandatory or is really important to do the generous sampling because there could be a stem or even there could be some foci of the leiomyosarcoma is present. So, what are those morphological features which will help us to differentiate the tumor from the leiomyoma and label it as a stump or label it as a leiomyosarcoma? So, basically, there are three important features which all are the morphological features. So, we do not need any immunohistones to differentiate it from one category to another category. So the all important three morphological features are the tumor cell necrosis, which is a coagulative type of a necrosis, and then is the cytological atypia, and the third is the mitosis, mainly the higher number of the mitosis rather than the atypical mitosis. So out of these three morphological features, if only one feature is present, then we can label it as a stem. And if two or three features are present, then most likely we are dealing with the leiomyosarcoma, which has the poor prognosis as well. So we will discuss about these features and we will see how histologically we can see these type of the features. So now the diagnostic criteria as we discussed. So one of the three criteria for the leiomyosarcoma, either coagulative tumor cell necrosis, cytological atypia, or the higher number of a mitotic activity. There are other parameters as well which will help, but these are not strict, these are not mandatory. So which includes atypical mitosis, vascular involvement, or infiltrative or the irregular margins. And the stump is further subdivided into three subtypes, which includes spindle variety, epithelioid variety, and the myxoid type of the stem. Depends on the what type of the cells features are present in there. So in this video, we will only focus on the epithelioid and the myxoid because these are the two subtypes which has the higher predilection of the reoccurrence, and they are the one which are commonly present compared to the spindle variety. So as we discussed in our previous video about the epithelioid leiomyoma, which was the benign category, in which we commonly see the cells are polygonal, they are rounded, they have the higher cytoplasm or clear cytoplasm, but they lack all three features, which includes they do not have the cytological atypia, the mitosis count is less than 2 mitosis per 10 high power field, and there is no necrosis. But if even one of them is present, either moderate to severe cytological atypia, coagulative necrosis, or if there is greater than 4 mitosis per 10 high power fields, then we can label or most likely we are dealing with the epithelioid type of the stem. While in terms of the myxoid type of the stem, is still the same what we discussed about the epithelioid leiomyoma, that even presence of necrosis, irregular borders, infiltrative borders, cytological atypia. So either when one of them is present, then we have to raise our suspicions from the benign category to the stem. So this is the first picture in which we can clearly say or what has been defined as a transition. So transition from the viable cells to the coagulative necrosis. So here in this picture we have a coagulative necrosis, which here we can see there is a transition of the viable cells, and there is an coagulative necrosis. And here we can also see like looks like they have the infiltrative type of the borders, but there is no high number of mitosis, and the cells still appears blind and wavy, but they do not possess moderate to severe type of atypia, which we will see in the cases of the leiomyosarcoma. And this is another example of a high number of mitosis. So these yellow circles represents those high number of the mitosis. And this is the example of a epithelioid stem. Here we can see like these are the big fascicles which contains high number of cellular cells, and they contain the high polygonal epithelioid type of the cytoplasm, and there is a lot of mitotic activity present. And this is another parameter or the diagnostic feature for the stump is that they have the irregular borders, looks like they have the infiltrative borders, but again, no more than one diagnostic criteria is present. So, in terms of a prognostic factors, why it is necessary to pay attention on those three diagnostic features is that because if we label any case as a stem, there are chances there will be a reoccurrence. So, in terms of a reoccurrence, epithelioid and the myxoid stem more likely to reoccur compared to the spindle variety, and their mean time of the reoccurrence is 47 months. So sometimes when they reoccur, they can reoccur same as like the initial stem, the way it was diagnosed, or in the next reoccurrence, they can be full blown to the leiomyosarcoma and they acquire more morphological features. So in terms of a treatment, surveillance is warranted whenever we diagnose the stem. So that's why it is very necessary to pay attention on those features. So commonly, surveillance is warranted every 6 months for up to 5 years, and then once yearly. So this is the end of my video. Thank you so much.